kumain ng iba't ibang pagkain. 2. Kay baby sa unang 6 months breastfeeding at mula 6 months angkop na pagkain. 3. Araw-araw maggulay at prutas. 4. Isda o karne at pagkain mayaman sa protina. 5. Uminom ng gatas at kumain ng calcium-rich foods. 6. Tubig at pagkain tiyaking malinis at ligtas. 7. Gumamit ng iodized salt. 8. Hinay lang sa maalat, mamantika, matamis. 9. I-maintain ang tamang timbang. 10. Maging aktibo, araw-araw ehersisyo. Huwag manigarilyo, alak iwasan mo.
Ito ang bagong gabay sa wastong nutrisyon. Ito ang bagong gabay sa wastong nutrisyon. Ito ang bagong gabay sa wastong nutrisyon. Para sa Pilipino.
Pinggang Pinoy. Pinggang Pinoy.
Alam mo na ba na may bagong gabay para sa lakas at kalusugan mo? Simpleng-simple lang at madaling tanda. Ang tawag dito'y Pinggang Pinoy. Gulay at prutas, 1/2 ng plato. Kanin o tinapay, 1/3 ng plato mo. Isda o karne, 1/6 ng plato mo. Ito na ang Pinggang Pinoy. Isang modelong pinggan, sukat na sukat bawat pangkat ng pagkain. Kaing balanse sa nakatatanda, mainam din sa bata.
Pinggang Pinoy.
Gulay at prutas, 1/2 ng plato.
Pinggang Pinoy.
Kanin o tinapay, 1/3 ng plato mo.
Pinggang Pinoy.
Isda o karne, 1/6 ng plato mo.
Pinggang Pinoy.
Pinggang Pinoy.
DOST. Halina kayo, kain na tayo ng brown rice. Masarap na mas masustansya pa kesa white rice. Vitamin at mineral, siksik pa rin. Pampalusog ng katawan ng bata't matanda. Para sa ating lahat, ang brown rice. Sagot sa malnutrition, iwas cancer, diabetes at sakit sa puso. Konting kain lang, mabubusog ka na. Halina, tulungan ang bayan. Halina, mag-brown rice na. Mag-brown rice na.
Everything today is faster. Everything today is easier. With technology getting better, it doesn't mean we're getting healthier. While the kids are young, while the parents are working, while the stress is tough, just remember the following. Go for a daily dose of nutrition. Go for a balanced meal with variation. Go for a run or two of exercise. Aim for healthy lifestyles. inspire others to do the same. The story of life is no game. Life doesn't need to end that fast. If you choose health, the longer you last. Go for a daily dose of nutrition. Go for a balanced meal with variation. Go for a round or two of exercise. Aim for healthy lifestyles. Go for a daily dose of nutrition. Go for a balanced meal with variation. Go for a round or two of exercise. Aim for healthy lifestyle. Live longer, happier, better with FNR.
Ang awiting ito'y gabay sa Pilipino para sa gustong nutrisyon. Kalusugan natin dapat number 1. 10 tips lamang ang inyong tandaan. Number 1, kumain ng iba't ibang pagkain. 2, kay baby sa unang 6 months breastfeeding at mula 6 months angkop na pagkain. 3, araw-araw maggulay at prutas. 4, isda o karne at pagkain mayaman sa protina. 5, uminom ng gatas at kumain ng calcium-rich foods. 6, tubig at pagkain tiyaking malinis at ligtas. 7, gumamit ng iodized salt. 8, hinay lang sa maalat, mamantika, matamis. 9, i-maintain ang tamang timbang. 10, maging aktibo, araw-araw ehersisyo. Huwag manigarilyo, alak iwasan mo.
Ito ang bagong gabay sa wastong nutrisyon. Ito ang bagong gabay sa wastong nutrisyon. Ito ang bagong gabay sa wastong nutrisyon. Para sa Pilipino.
Tinggang Pinoy, tinggang Pinoy.
Alam mo na ba na may bagong gabay para sa lakas at kalusugan mo? Simpleng-simple lang at madaling tandaan. Ang tawag dito'y pinggang Pinoy. Gulay at prutas, 1/2 ng plato.
implemented paano Jen?
Nuts. Yan.
Pwede ka lang makaproceed. Ano pa bang ibang kuwan? Suning na lang, no?
Good morning, everyone. Welcome to our webinar on the features of the Dost-Pinoy, or the package for the improvement of nutrition of young children website. I hope everyone is safe and well as we begin our webinars. If you have been attending our webinars on the past few weeks, this is still a part of the Ifnri webinar series tackling the website's new features since it was relaunched last year. The IFNRI website is in line with the DOST-FNRI's mandate of disseminating food and nutrition information among our stakeholders in the form of web-based information and services. The Dost-Pinoy website is under the iPromote component of the IFNRI that provides updates on the malnutrition reduction program of the DOST-FNRI. Before we begin, let me just read a few gentle reminders to our participants. To properly identify our attendees, may we ask for you to change your names into this format, company_name. To rename, please click the participant button on the bottom portion of your Zoom window. Hover your mouse over your name on the participant list, click more, and click rename. As respect to our speakers and to prevent any distractions to our co-participants, may we ask to please keep your microphones on mute during the discussion. Please make sure that your Zoom is in speaker view format for better viewing of the webinar. The button is located at the upper right corner of the Zoom screen. Questions are most welcome. We will have an opportunity to ask your questions at the end of the discussion. If you have any questions, you may key in at our chat box to be addressed after the presentation or during the open forum. Certificates will only be given to Zoom attendees who have successfully answered the pre-test, post-test, and evaluation forms. If you have accomplished our registration through our provided Google link, you have already answered the pre-test. We are all hoping for a stable internet connection. If disconnected, kindly wait for the Zoom window to resume. If your internet connection permits, you may open your camera so we could see you virtually. Again, thank you and welcome to our participants from the different regions and provinces of the Philippines. I see participants from the local government units, from provincial representatives of different provinces in the Philippines. We have attendees from the National Nutrition Council, and of course, the DOST regional offices are also present, as well as the provincial science and technology centers. Again, from different regions, I see representatives from Region 1 hanggang BARM po. So welcome po sa ating lahat, and thank you again for attending our webinar for today. So I am Jean Sune from the Food and Nutrition Training Unit, and I will be your facilitator for this activity. So for today's session, we'll be presenting the Malnutrition Reduction Program, followed by the features of the Dost-Pinoy website. So to start, may I call on Ms. Kelia Colin CDS to lead us in a prayer.
Okay, good morning po sa ating lahat. Bago po tayo magsimula ng ating programa, ilagay po natin ang ating sarili sa presensya ng Panginoon. Panginoon, maraming salamat po sa panibagong araw na ibinigay niyo po sa bawat isa sa amin. Salamat po sa pagkakataon na ito na kami ay nagkakatipon-tipon, bagamat po ay virtually ay kami po ay sama-sama na a-attend at makikinig po sa webinar na ito. Gabayan niyo po ang mga speakers, ang aming pong facilitator at ang lahat po ng kasama po namin dito sa webinar na ito. Nawa po ay marami po silang matutunan mula sa ating mga sa ating resource speaker. Gabayan niyo po ang bawat isa sa amin at ilayo niyo po kami sa pagkakasakit at sa pandemyang ito. Ito po ang aming samot dalangin sa inyo pong pangalan. Amen. Morning po.
Thank you, Colleen, for the prayer. Again, welcome po sa ating mga participants for this webinar on the new features of the Dost-Pinoy website. So to address the persisting malnutrition problem among children aged 0 to 23 months old, DOST-Ifnri developed the Malnutrition Reduction Program and was rolled out to different regions in the country since it was pilot tested last 2011. To discuss the Malnutrition Reduction Program, let me call on our speaker from the Nutrition Intervention, Evaluation, and Policy section. She is a registered nutritionist dietitian, had her Bachelor of Science in Nutrition at the University of the Philippines, Los Baños. She also earned her units in MS in Applied Nutrition at the same university, currently involved in monitoring evaluation of nutrition intervention models, currently a Science Research Specialist 1. Let's all welcome Ms. Joanne Jet S. Gulay. Good morning, Ms. Jet.
Hello.
Yes po, good morning po.
Hello, Jane.
Ms. Jet.
Hello, can you hear me?
Hello?
Yes, ma'am, we can hear you.
Okay na ba siya? Miss? Hello? Hello? Okay na? Hello?
Yes, Miss Jen.
Hello. Ayan. Good morning, everyone. Jane, I would like to share my screen. Okay, good morning po sa ating lahat. Welcome to the webinar on the features of iPromote or the Dost-Pinoy homepage. So today, with Ms. Nessie and G. Buiko, we will be presenting to you the Malnutrition Reduction Program and the Dost-Pinoy homepage in the IFNRI website. So first, I would like to share who we are and what we do in DOST-FNRI. DOST-FNRI is the principal research arm of the government in food and nutrition, and it is one of the research and development institutes in the OST. It is guided by the socio-economic agenda of the administration, the Philippine Development Plan, or PDP 2017 to 2020, the DOST Strategic Plan 2017 to 2020, or the Science for the People, and it also pursues the objectives of the Science for Change program and the Philippine Plan of Action for Nutrition 2017 to 2020. Under the Executive Order Number 128 signed on January 30, 1987, the FNRI is the following mandates to perform these functions. First is to undertake researches that define the citizenry's nutritional status with reference to the malnutrition problems, its causes, and its effects. It also develops and recommends policy options, strategies, programs, and projects for implementation by appropriate agencies. And it also diffuse knowledge and technologies in food and nutrition and provide science and technology services to relevant stakeholders, as per Executive Order 360, signed in November 13, 2009. The FNRI visions that all Filipinos to have optimum nutrition, to be socially and economically empowered through scientifically sound, environment-friendly, and globally competitive technologies. And as the lead agency in food, nutrition, research, and development in the country, the FNRI's mission is to provide accurate data, correct information, and innovative technologies to fight malnutrition. We'd like to share the Institute's major accomplishments. One of these is the conduct of the National Nutrition Survey, and recently it evolved to the expanded National Nutrition Survey. The Institute also develops strategies and programs to address the malnutrition problem, and one of these programs is the Malnutrition Reduction Program. The Institute also develops and commercializes nutritional food products. And these are some of the examples of FNRI developed nutritional food products. So we have the rice mongo curls, the nutty fruity bar, and the mums. We also develop analytical food quality and safety assurance systems, as well as tools, guidelines, and standards to serve the needs of nutrition and nutrition-related workers. So some of the examples of this is the recently updated food exchange list for meal planning, the PDRI 2015, the Pinggang Pinoy, and the menu guide calendar.
Good day po, Miss Jen.
So now I would like to share with you what the malnutrition reduction program is. So based from the data of the 2019,
Miss Jet, excuse me po. Miss Jet, can we request po na malakasan po yung audio? Medyo mahina po yung audio po ninyo. Thank you po.
Mute na lang. Okay, so based from the 2019 expanded National Nutrition Survey, undernutrition remains to be a public health problem. And based on the trends and the prevalence of malnutrition among Filipino children aged below 2 years old, 3 out of 20 or 13.9% of the children among 0 to 23 months old were underweight. 5 out of 20 or 21.9% were stunted, and 3 out of 50 were wasted. And based on it is important that malnutrition should be addressed among young children before they reach 2 years old, because the physical and mental effects of malnutrition is irreversible. And when they reach adolescent and adulthood, it can reduce their productivity, can increase the healthcare costs, and later on contribute to the slow economic growth. The malnutrition reduction program has two components. The first is the technology transfer of FNRI developed complementary food blends and snack foods. The FNRI developed these complementary food products. The first is the Rice Monkey Instant Blend and the Sesame Ready to Cook Blend. So these complementary food blends are intended for 6 to 23 months old children, while the Rice Monkey Pearls and Crunchies are for children 1 year to 3 years old. And in 2011, the DOST intervention on complementary feeding, wherein the complementary food products were used, and the nutrition education using the DOST FNRI developed module was field tested in 4 provinces with high prevalence of malnutrition among children below 5 years old. In that study, it was noted that there is a positive result in contributing to the reduction of underweight of 6 to 35 months old children. And there is a significant increase in the improvement of knowledge among mothers and caregivers who attended the nutrition education wherein the Dost-Pinoy modules were used. And these are the areas wherein the field testing was done: Antique, Occidental Mindoro, Leyte, and Iloilo. So there are 34 complementary food production facilities nationwide. So it was established all over the country in partnership with local government units, state universities and colleges, and NGOs. And if naka-attend po kayo last week, this was discussed by Sir JP De Juan using the ET2M2 or the Electronic Technology Transfer Monitoring Map, which is part of the I Promote feature of the IFNRI website. The second component of the malnutrition reduction program is the Dost-Pinoy strategy, which is means the package for the improvement of nutrition of young children. So the Dost-Pinoy strategy has two main activities. The first is the food-based intervention, wherein there is a 120 feeding days for complementary food, wherein the DOST-FNRI developed products were given to 6 to 35 months old children. So ito po yung rice mongo instant blend, rice mongo sesame, ready to cook blend, the rice mongo curls and crunchies. And the second major activity of this is the nutrition education, wherein mothers of the children participants were taught using these modules. So these modules were developed by DOST-FNRI. The topics included in the nutrition education is the basic nutrition or mga topics regarding sa nutrition, sa health. Next is pregnancy, and then breastfeeding, complementary feeding, meal planning, food safety, and gardening. So kung kanina sa first component ng MRP is it provides us supply, the second component of the MRP is it provides us, it answers the demand strategy of the intervention. And since 2012, and in 2012, the Dost-Pinoy under the Malnutrition program was rolled out nationwide. And since then, continuous po ang expansion and promotion of the adoption of the Dost-Pinoy to address undernutrition among Filipino young children nationwide. The first activity is through orientation and advocacy among LGUs. So here are some pictures from different advocacy meetings held nationwide. And this year, we explored the virtual advocacy meetings. So these meetings are with, I think, BARM. So with the use of Zoom meetings or Google Meet and other virtual platform, we can conduct advocacy meetings like this. And another is capacity building among community workers and program implementers through the Dost-Pinoy training. So these are some of the pictures from different trainings we had nationwide. The MRP is also answers and supports the PPAN or the Philippine Plan of Action for Nutrition 2017-2022, as stated in one of its section that priority should be given to the nutritionally vulnerable or the pregnant and lactating women, infants, and young children 0 to 23 months old. And the program also supports the first 1,000 days law or the RA 11148 or the Kalusugan at Nutrisyon ng McNamara Act, which aims to address health and nutrition problems of newborns, infants, and young children, pregnant and lactating women, and adolescent females. And MRP also aims to contribute in one of its sustainable development goals, which is to end all forms of malnutrition in 2020. I would like to share that MRP is certified by the National Economic and Development Authority since 2015 until 2020 to be included in the National Priority Plan. So inclusion in this National Priority Plan entitles donation under the program to be tax deductible in full as stipulated in one of its section of the section of the National Revenue Code. And it can be done through cooperation with the private sector and is covered by a memorandum of agreement in coordination with the respective agencies' accounting division for proper recording of donations. And to recognize the efforts of the LGUs who continuously implement the program, and for technology adopters of the complementary food production facilities, the Kabalikat Award was done in 2018. And here are the winners of this Kabalikat Achievement Award in 2018. So there are two categories. One is for the local government who continuously implement the program, and for the technology adapter of the complementary food products. And I would like to share the accomplishments of the program since 2012. So up to date, there are 41 approved policy resolutions which adopt the MRP Dost-Pinoy in their respective LGUs. There are 57, there are advocacy activities conducted in 57 provinces and 149 cities and municipalities. There are 5,829 community workers trained during the Dost-Pinoy trainings, and there are 14,600 children participants who were included in the complementary feeding. So based on one of our monitoring study, the key factors in the continuous implementation of MRP is the strong commitment of the DOST, the political will and the strong support of LGUs through resource allocation. Second is the approval of a local resolution for the adoption of the intervention in their area, mobilization and participation of local officials and implementers, and of course, the participation of the mother and child. Ways forward of the program is a support in the PPAN 2017 to 2022 that there should be continuous monitoring, advocacy, and promotion, and that this program is envisioned to be sustained and institutionalized in the LGUs as part of the first 1,000 days program of the government. And we hope that through the local budget memorandum number 77 of the DBM, that there should be a budget allocation for nutrition programs like the Malnutrition Reduction Program to be funded and be implemented in the LGUs. And despite the pandemic and all the health protocols being done, the MRP can still be done and as supported by the following memorandum circular and advisory. So based on the DSWD memorandum circular number 12, series 2020, guidelines in the implementation of the supplementary program during the community quarantine period or other similar emergencies, it is identified that the DOST-FNRI developed food products to be included in the food commodities for distribution during the supplementary food program. While the Nutrition Cluster Advisory number 1, series 2020, which is on guidelines of LGU nutrition actions relative to COVID-19, it provides guidance in the distribution of healthy and nutritious food packs during states of public health emergency, and it also states that the LGUs may consider the use of commercially prepared complementary food products developed by the DOST from the listed complementary food production facilities. And with this, we invite you to adopt and implement the MRP Dost-Pinoy Nutrition Intervention Strategy in your respective LGUs. For other information, you may contact our director, Dr. Imelda Angeles Agdepa, Director for Science. So now, Ms. Nesri Anjibuiko will demonstrate to you how to navigate the MRP Dost-Pinoy homepage. So this is the URL for the IFNRI website. Over to you, Nes.
Yes, Paul, thank you, Ms. Jet, for your presentation. Let me introduce Ms. Ness, who will be presenting the features of the IFNRI website. So let me just share my screen po. Okay, Ms. Nesrian G. Boyko is also a registered nutritionist dietitian. She had her Bachelor of Science in Community Nutrition at the University of the Philippines. She is also part of the Nutrition Intervention, Evaluation, and Policy section. She is involved in nutrition intervention and evaluation research and trainings related to DOST-Pinoy. Let's all welcome currently Science Research Specialist 1, Ms. Nesrine G. Buico.
Hello, thank you, Ms. Jane. Good morning, everyone. Yes, I'm Nes. Can you hear me clearly po? Malinaw po ba ang sound
Yes.
ko?
Yes, po, Ms.
Right.
Nes.
Okay, thank you. So I'm Nes again, and I will give you a walkthrough of one of the programs under the I Promote, the DOST-Pinoy. So first, let me share my screen. Can you see the screen? Kita po ba yung ating screen?
Yes po, Ms. Nes.
Alright, thank you. So ito po yung website ng IFNRI. So yan, i.fnri.dost.gov.ph. So to enter, we will click the logo and input our username and password. If wala pa po tayong username and password, we need to register. So kailangan po nating mag-register para makita natin at paggamit yung features and ma-explore natin yung IFNRI. So once we input our username and password, we will log in. And for the previous attendees, so familiar na kayo sa malunggay. So bawat dahon ng malunggay, papakita yung mga different components of the IFNRI. We have iServe, iBusiness, iLearn, iAssess, iTrain, and for today, iPromote. So we'll click iPromote. And then we'll see ET2M2 na banggit kanina ni Ms. Jet sa kanyang presentation when it comes to the mga adopters. And then now we will explore DOST-Pinoy. So we'll just click this. So here we can see the initial homepage of the DOST-Pinoy. Nandito yung mga pictures ng complementary feeding blends na na-discuss kanina and yung mga modules na ginagamit sa training. On the right side, we can also see the description of the DOST-Pinoy, the two components, the technology adoption and the intervention components or nutrition intervention strategy. And then we have our contact detail dito po sa baba who you can contact on inquiries specifically for DOST-Pinoy. Let's continue with the website. So after clicking that, it will redirect us to the actual homepage of the DOST-Pinoy. So this is the updated logo of the MRP Dost-Pinoy, and you can also see other photos ng mga activities na ginagawa ng DOST-Pinoy. So we have advocacy, ito yung una, no, sharing to the LGUs, yan. Training or capacity building, skills training for the community health workers na siyang mag-implement ng program. And then the implementation. And of course, we need to monitor if the project is working or the program is working. If we scroll down, there, so another description, and we also have two videos here from uploaded in YouTube. So you can watch them later after the webinar. On the left side is about MRP Dost-Pinoy, kung ano ito, saan galing, ano yung history ng MRP Dost-Pinoy. And then on the right side is the DOST, the presentation of MRP in the DOST National R&D Conference in 2018. So sa dulo ng homepage, we have downloadable forms. These forms are updates of the project na sinesend namin sa mga LGU. So yung ibang LGUs dito na nanonood, so baka naka-receive po kayo nitong mga updates na ito. So we send them to LGUs to keep them updated kung ano na po bang status ng MRP, Dost-Pinoy, project anak sa kanilang mga lugar. So next feature of the DOST-Pinoy is the e-map. So just click that and let's wait for the page to load. So there, you can see sa left side is the map of the Philippines with yung mga red pins. So the red pins, sila yung mga areas na nagkaroon na ng advocacy, monitoring, ng advocacy trainings, monitorings, or even implementation ng ating programang MRP Dost-Pinoy. So you can click them to see yan, ano na ba yung general status or update sa lugar. So makikita niyo buong Pilipinas siya, but if you want to explore yung sa region lang ninyo, for example, let's go to Calabarzon, and then let's click the search button here. So yan, ang lalabas lang would be from your region. So let's click this one. So I think this is Calatagan. So for kung gusto naman natin nang makita yung buong details, more information, we will click the area sa right side ng ating screen. So we will click view, doon tayo sa Calatagan, for example. So ayan, so may photos ng naging advocacy, trainings. So nangyari siya 2014 pa. 20 participants, and then we have 35 participants noong training ng May naman of the same year, 2014. So nagkaroon ng first cycle of feeding nung nag-end siya noong June 22, 2015. So these areas we are continuously updating. Baka po makita niyo yung sa areas niya hindi pa updated, so you may also send us concerns doon na parang paki-update. But you know, we are continuously updating this page, yung mga areas natin. So from 2012 to 2020, yung mga areas na nilalagay po natin ina-update. Medyo madami. So here, sa Mimaropa, again, example. So, this is Española. So, yan. Ganito, ganun lang din naman po yung makikita natin. You know, kailan yung naging advocacy, kailan yung naging training, and then kung may monitoring na ba or tapos na ba yung implementation. Alright, so that's it for the EMAP feature. We have another example. So Region 1, sa La Union naman. So, ayan, meron tayong 2014 din ginawa yung kanyang advocacy and training. So madaming participants, 46. And then nagkaroon ng 58 children beneficiaries from at baseline and the end line. So ito po yung mga makikita nating details kapag venue natin itong mga areas. So, okay, next would be the, next feature would be the downloadable files. So here, as mentioned ko kanina sa homepage, sa pinakadulo yung mga downloadable files, mga updates yon for the LGU. So here, ayan, MRP and Project Anak. So baka nagtataka kayo bakit may Project Anak since MRP lang yung diniscuss. Project Anak is not that different from MRP. It's still anchored to the DOST-Pinoy strategy, although this time it's a delivery system research na mas nagfo-focus sa linking, paglilink, or pag-uugnay sa mga LGU sa mga complementary food production facilities para mas mapabilis yung mga areas na may malapit na CFPF. So doon kinoconnect ni Project Anak. Okay, so let's see an example. So ito siya. You can download this and then for a copy para sa inyong LGUs. Although, as mentioned, sinesend naman din po namin ito sa provincial offices and then sa municipal offices ng mga LGUs. Specifically yan for them. And also sa DOST regional and provincial offices as well. And also NNC regional offices. So we also send them. But in case you want a copy for your offices, specific sections or offices sa inyong LGUs, you can also download this. So let's see an example for Project Anak. Yan, so this one. Yan siya. So pinapakita lang yung mga in action, advocacy training, ano po yung next steps, nag-i-implement na ba, or for monitoring na ba itong lugar, may local resolution na ba, or we're still waiting for the approved local resolution. So that's it for the downloadable files. Next would be the awards, which were mentioned by Ms. Jet kanina din sa kanyang presentation. So, yan, kasama included ang MRP, DOST-Pinoy, Saneda National Priority Plan. So, this is a list of government's priority programs, projects, and activities. So, doon tayo sa area of health. And then next, so, hindi lang po nakakatanggap ang MRP ng awards, we also give recognition to the implementers and adopters of DOST Ifnri technologies through the Kabalikat Achievement Award. So in 2017, the Malnutrition Reduction Program was also presented in a conference at Tunisia in Africa and is one of the recipients of the projects that work. So isa po tayo sa winner that year, 2017. From FAMER, Foundation for the Advancement of International Medical Education and Research. Okay. Next is, of course, we have the list of published journal articles. These are peer-reviewed journal articles. You may view them or read them through the URLs or DOIs there. So lahat po ito related to the Malnutrition Reduction Program. Mga nagbunga na journal articles from that science-based, evidence-based na mga journal articles from the project. Next would be, of course, we are also mentioned in some news articles. You may also copy the titles and then search in Google para po mabasa natin yung buong article. Of course, sa own agencies' annual reports, kasama tayo. And aside from news articles, may mga several websites din na na-include or na-feature yung MRP Dost-Pinoy for its efforts in reduction of malnutrition among children. So this is the last features. And then for the, so may contact us dun sa dulo if you have any concerns or issues na nakita sa ating website, sa mga details, sa mga information, you may send us a message. And just type your name, email, tungkol saan po yung concern, and then kung ano po yung gusto nating sabihin, and then you just send us a message para mabasa and ma-update natin yon and masagot din po namin kayo. So that's it for the Dost-Pinoy. If you have any questions, you may type them in the chat box, and para po later sa ating open forum, masasagot po natin. Thank you, Ms. Jane. Thank you.
Yes po. Thank you, Ms. Ness, for your presentation on the features of the Dost-Pinoy website. No? So I hope po this would help our implementers or even our future implementers sa implementation po ng ating malnutrition reduction program within their municipalities or provinces. Actually, yung karamihan po ng ating mga participants ay nakapag-implement na po currently or no mga past few years ng ating malnutrition reduction program. And thank you po again for attending our webinar para po ma-update din po tayo ano na po ba yung mga narating pa ng Malnutrition Reduction Program or the Dost-Pinoy intervention na diniscuss po kanina. So again, magandang opportunity po ito, no? If you have any questions, you may key in your clarifications or queries sa ating pong chat box. No? Again, ang malnutrition reduction po is nakakatulong sa mga batang age 6 to 23 months sa panahon ng pandemya na karamihan po sa mga pamilyang Pilipino ay hindi po nakakakuha ng sapat na pagkain para sa kanilang pamilya. And we value the lives of the children, especially po na yung ating first 1,000 days, which pinapakita ng tamang nutrisyon or sapat na nutrisyon sa ganito pong edad. So, our virtual floor is now open for questions or any clarifications po ng ating mga participants. We have a question here po from Miriam. Hi, Ma'am. Good morning po. So for our speakers, just to clarify po, are all LGUs which utilize the Dost-Pinoy technologies, are they required to pass a resolution regarding the malnutrition reduction program?
Hello.
Yes, go ahead po, Ms. Jet.
So to Ms. Miriam, during the advocacy meeting, we encourage LGUs to pass a local ordinance or resolution. Pero ngayon, with the help of other agencies, mas okay po if the areas which implemented the Dost-Pinoy can pass a resolution po. it is encouraged po. Yun po.
Yes po. Thank you po, Ms. Jet. This will also help sustain the program po if we have or ordinances po with the implementation of the malnutrition reduction program. We also have a question here. How can we implement po the malnutrition reduction program in our municipalities? So meron po bang proseso po ng pag-implement po nito?
Ayun, hindi ko na lang i-off yung camera. First po is, our first activity po is we do advocacy meeting with LGUs wherein dinidiscuss po namin yung mga details po nitong malnutrition reduction program. And then after po is we do the Dost-Pinoy training or the capacity building among community workers. And then after po nun is pwede na pong ma-implement yung programa sa LGU. Ayun po.
Yes po. Thank you po, Ms. Jet. So, maganda rin po na i-coordinate naman po ito ng DOST-FNRI for the implementation po ng malnutrition reduction program. We have another question po. No? I think this is for Ms. Ness. Para po dun sa mga nag-implement na po nung DOST-Pinoy intervention, can we download sa malnutrition, sa Dost-Pinoy intervention, meron po tayong trainings which contains the pre-test and post-test and other training materials. Pwede po ba itong ma-download po sa website?
Thank you for the question. As of now, wala pa po tayong naka-upload ng mga pre-test or post-test, yung mga materials po natin sa website. As much as possible, gusto din po sana namin na through right now wala pa, pero we can pwedeng pag-usapan ng team if ever kung mas madali po ba na naka-upload na lang sa website yon. As of now, personal po through email or nung wala pang pandemic, doon mismo sa area binibigay po namin yung mga copy ng materials. But yes, we will look into it if we can incorporate then sa website yung mga materials. Thank you.
Thank you po, Ms. Ness. Let me just share po yun pong response ni Ma'am Miriam. No? Thank you. Do we need to incorporate it? Yun pong napag-usapan resolutions, pagpapasa ng resolutions regarding the MRT. Do we need to incorporate it po sa mga memorandum of agreement, especially with our CEST projects?
Yes po, pwede po itong i-incorporate.
Yes po, no? So makakatulong po talaga yun pong ating resolutions. And again, we thank also the DOST regional and provincial offices sa mga CES projects po nila dahil isa po ang malnutrition reduction program sa mga napipili po nilang CES programs or CES component po ng kanilang mga programa on health. Are there any other questions po from our participants? Any clarifications po? We have another question here po, no? So talagang medyo challenging po ang implementation during this pandemic. How can we implement po the feeding program and nutrition education classes? Especially po ngayon na syempre nililimitahan po natin yung mga paggugrupo-grupo ng ating mga beneficiaries.
For the nutrition education, no? Jane? Hello?
Yes po, ma'am. Feeding program and nutrition education classes.
Ayun po. So, isa po sa mga nire-recommend namin for LGUs na mag-implement ngayon during the pandemic is we can have a schedule wherein mayroon lang pong limited number of children to go to the centralized feeding. And meron din namang areas na medyo mahirap makapunta dahil nga merong mga iba-ibang protocol sa iba-ibang lugar. So isa rin sa mga suggestion is dry ration, kung saan binibigay yung complementary food sa nanay. Pero dapat naturuan yung nanay ng program ay ng community worker kung paano i-prepare specifically for the complementary food blend. Ayun po. So, meron pong limit ng number for centralized feeding, pero pwede rin naman po na dry ration or ibibigay po sa nanay ng children participants. And for the nutrition education, same po, dahil mga nanay, meron din pong limit ng number of mothers na umattend during the nutrition education classes. And syempre, meron pong lagi pong i-remind yung regarding sa health protocols na gagawin during the Nutri-Ed. So like, kailangan magdala or mag-provide ng sariling ballpen or ng pencil for the pre-test and post-test. And same with the complementary feeding for the centralized feeding is to bring their own eating utensils.
Thank you, Ms. Jet, for your answer po, no? We have another question here po from Jocelyn. Let me just read po, no? From Jocelyn from Virac po, no? They had already an ordinance supporting the malnutrition reduction program, and they are currently trying to incorporate the funds needed in the supplemental budget this year. So, do they need to send the ordinance to the DOST-Ifnri?
Yes, please. Opo. Please send po a copy of the approved local resolution po sa FNRI for filing, and then po. Thanks po.
Yes po. We will, ang alam ko si Ma'am Zarina po yung contact, or you can send the resolution po through your provincial science and technology centers po, no? I think ito po ay coordinated naman po since Virac is also part of our priority area for the malnutrition reduction project. Yes po, Ma'am Miriam, we will send you po your request to MRP document from the concept, objectives, and deliverables po, no? So, kung meron pa po tayong mga participants na interested din po to adopt the Dost-Pinoy intervention, you can send us an email para po bigyan po namin kayo ng further details po ng mga kailangan po ninyo for the implementation po of the Dost-Pinoy intervention. We have another question po from DOST-7. So enhanced nutribans are currently being promoted by the IATF on Zero Hunger to combat hunger and malnutrition. Ano po ba ang prescribed age na pwedeng kumain nito? So, ang tinatanong po ni Sir ay yung technology po natin, no, on the enhanced nutribans. So currently po, ang sinasagot po na nutribans is actually for general public naman po siya, but the DSWD and the DepEd are promoting the enhanced nutribans para po sa kanilang supplementary feeding. So ito po ay pwede naman sa any age, any Filipino age, basta po kaya na pong kumain ng tinapay. Ano po? Ms. Jet, can we clarify po ano po yung intended beneficiaries po ng ating blend and yung ating snack foods?
For the complementary food blend, the instant blend and the ready-to-cook blend po is for 6 to 23 months old children, while for the snacks and curls and crunchies po is for 1-year-old to 3 years old.
So siguro po pwede po nating gamitin yung enhanced nutriband or even yung snack foods po natin, no? Kasi yung snack foods po natin is parang kung familiar po kayo sa mga nakikita po natin na snack foods sa areas, no, na meron pong yung puffed or fried snacks po. Yun po, pwede na po yun sa older children. So siguro pwede po nating pagpalitin yun. Okay po. Yes po. Okay. So mayroon pa po ba tayong other questions from our participants or clarifications po? Okay. Sige po, kung wala na po, our emails are always open po for any clarifications or concerns po na kailangan po nila, no? So you may email our director po for any other concerns regarding this program. So again, thank you po, Ms. Jet and Ms. Ness, for your presentation of the Malnutrition Reduction Program and the features of the DOST-Pinoy website. So I hope po no, ito po ay makakatulong sa ating mga participants sa kanilang updating or future implementation ng Malnutrition Reduction Program. All right, that sums up our webinar session on the features of the DOST-Pinoy website. Thank you to our speakers and to our participants for your active participation. We hope that this webinar provided insights that could help your concerns related to nutrition and the first days of a child's life. So let us capacitate our young children by building their mind and body through proper nutrition, as the saying imparts, ang kabataan ang pag-asa ng bayan. So before we end, let me just read a few reminders. The link for the post-test and evaluation is posted at our chat box. Please click the link and submit a response. Also, please note that the post-test evaluation link will only be open until 1 p.m. today, May 6, 2021. Again, our post-test and evaluation link will only be open until 1 p.m. today, May 6, 2021. Also a reminder, only Zoom attendees who have accomplished pre-test, post-test, and evaluation will receive the certificate. So we advise for you to answer the post-test and evaluation at this moment. Please give us 7 working days to process the certificates, which will be sent through your email. Again, please give us 7 working days to process your certificates, which will be sent through your email. Please ensure that you input a working email address in our questionnaire. Otherwise, your certificates will be sent invalid or wrong email address. Your response will also be our reference to your certificate, so please check the spellings of your name. Again, please give us 7 working days to process your certificates. Okay, again, we thank you for finding time for attending our webinar. We still have 2 upcoming webinar sessions under the Ifnri series. On May 21, we will be having the webinar on the features of iLearn, Nutrition School, and e-games. And on May 28, we will have the features of the iTrain and the EFCD DEA. Registration procedures will be posted on the DOST-FNRI official Facebook page. So please like and follow our Facebook page to get the latest updates on DOST-FNRI. We hope to see you again in our future webinars. Thank you for attending and keep safe.